What is immunotherapy and how does it work to treat bladder cancer?
So immunotherapy, the analogy that I often use when I see patients is immunotherapy goes in by IV and it acts as the drill sergeant and it trains your own body's immune system, who are the soldiers, to find and fight the cancer cells. So that's really how it works. The drug itself is training your own body to do the work. Most people will have no side effects from this and they tolerate it really well. However, because the immune system is getting a little bit activated, sometimes those soldiers or your immune cells can go rogue and they can start attacking normal healthy tissues in the body, almost like an autoimmune disease. So when on these drugs, it's really important, if anything is new or different, to let your doctors know, because it's often easy to troubleshoot over the phone or at a quick office visit if it's related to immunotherapy or not. So it's really important that you keep that in mind whenever a new symptom or anything may pop up.
Well, that's great information. It's really important to communicate any issues you may be having. So who is immunotherapy right for? Is it right for every bladder cancer patient?
So immunotherapy is used in several different settings for bladder cancer treatment. It's used in the metastatic bladder cancer treatment world mostly. Often we use it as either a second line treatment after chemotherapy or in a maintenance type approach after someone's completed their chemotherapy, meaning we plan for about 2 years of treatment. In patients that can't get chemotherapy for whatever reason, we can use immunotherapy as a first line treatment. And it's also used in localized bladder cancer, meaning cancer that's contained only to the lining of the bladder. In patients who've gotten treatments that go inside the bladder called BCG, when their cancer isn't responding, immunotherapy is also an option there.
What are some of those side effects that patients should look out for?
So what I tell everyone is they can get inflammation or an itis of anything. So some examples of that. If someone has rash, that's called dermatitis. That can be mild or it can be severe. If someone has inflammation of the bowels or colitis, they can have diarrhea that starts all of a sudden. Sure. Another example is pneumonitis or inflammation of the lungs. People may have cough, trouble breathing, low oxygen levels. It really can affect any organ system that you have. So that's why it's really important, if something feels different, to let your doctors know. It's also really important if you're not near your doctor for whatever reason and you end up seeing a local doctor, let's say at an emergency room, that you let them know that you've received immunotherapy, because they'll think about the problems that you're having a little bit differently.